First of all, thank you for allowing me to speak.
Please identify yourself, please.
Just a little bit about me. I am Dr. Arnold Feldman. A little bit about me. I was born in Philadelphia, Pennsylvania. Don't hold that against me. I've lived down south for 37 years, I think.
Who won the Super Bowl?
I understand. I came to the South. I went to Mobile, Alabama, where I met my lovely wife at the Mobile Infirmary in operating room number 4. We moved to Natchez, Mississippi, where I was not an anesthesiologist, the anesthesiologist for the entire town. I took care of the ICU, delivered babies in a place, and forgive my impertinence, where African Americans didn't get epidurals for labor and delivery. I insisted that everybody gets epidurals for labor and delivery. I worked myself to death. We have 2 children, 2 sons, and forgive me for my emotionalism, you'll see why. Our one son lives in Mobile, our other son lives in Baton Rouge. My mama wanted to be near the grandchildren, so about 15 or 16 years ago we moved to Baton Rouge, Louisiana. And my son Brandon worked for a big real estate company, and he found me a building, and I said, you know, this is a town that needs my services. I'm an expert in anesthesiology. I have pioneered minimally invasive laser spine surgery. I had a pain clinic before anybody knew what a pain clinic was, not an opiate clinic, a clinic where we made a diagnosis, made reasonable treatment, and rescued people. I, at one time, was a good friend of Cecilia Mouton, and I won't say anything deprecating about her personally. I always tried to follow the rules to a fault. My clinic was 22,000 square feet, across from the state police headquarters. 2 buildings, 2 MRI scanners, a CT scanner, a laboratory, a social worker, 63 employees and their families. I took care of and provided health care for them and their families, and I had an extended family, including my patients, were probably a couple thousand or 3,000 Louisiana citizens. So my mama, who died in Louisiana, said to me, you know, Arnold, you should be proud of yourself. I said, well, Mom, you put me through medical school. One day in 2013, I ministered to a patient who was a friend of mine, and we won't say his name. It is important, but it's not important for these hearings, and he died under my care. I insisted on an autopsy because that's never happened to me, although I've been in gunshot wounds, motor vehicle accidents, seen people die from cancer, sat with them when they died, took care of their pain, made their lives better. The autopsy, which was conducted in the East Baton Rouge coroner's office, of which I knew no one, said he died of natural causes. The pathologist, whose name was Cameron Snyder, didn't know him, said to me, I ran into him at a supermarket one day. He says, you know, Dr. Feldman, you don't know me? And he said, listen, I know you feel bad about that, but if this supermarket had a fire, this man probably would have died running to the door. His heart was that bad. So I felt that, well, I didn't feel good about it, but I reported it as required by state statute. Simultaneously with that, I was appointed to the Physicians Health Foundation. We minimize that, but this is an important aspect of this. I was appointed to the Physicians Health Foundation by the Louisiana State Medical Society, of which I was a member since the day I came here. They asked for volunteers, I volunteered, and it is my nature to help people. So I said, what better way than to help your colleagues? Like you said, you want them to be the best that they can be. And I felt that that was a good thing. The next thing you know, I find out that evil lurks somewhere in the halls. I was appointed to the Physicians Health Foundation. 3 months later, I thought to myself, did I miss the meeting? They had a secret meeting, and I was voted off the board. Now, they couldn't have hated me because I didn't know anybody on the board. But my investigations found that most of the people on the Physicians Health Foundation were impaired. I was not impaired. And somebody directed them to have a secret meeting and vote me off the board, and I found out why. The seat of power, which we heard some testimony today, the seat of power of the medical board is to accuse physicians of being impaired. If they accuse you of being impaired, you must consent without a reasonable trial, without exculpatory evidence being released to you, which we just heard, until it is so late in the game that you are either beaten down, financially indigent, or commit suicide. I spent $1 million on lawyers. I know more about this process than anybody in this room, including the lawyers for the board, because I have been through it. And I will tell you this. The Constitution of the United States is about 4,400 words. There is no due process in that place. What this bill purports to do, a Physician's Bill of Rights, we need this. I won't say much more. We need this. The Senate, despite some mild opposition, voted unanimously to pass this. You mentioned, I think, your relative or daughter-in-law. I have saved people's lives. I get phone calls every day. And just so you know, I was a moderately successful physician financially, not a rich guy. As my decorator said, just rich enough not to embarrass my rich friends, of which I have no friends anymore, except a few. I don't have a home anymore. I don't have a car. I'm essentially homeless, living in a motorhome. I lost my license in California, Mississippi, Alabama, where I pioneered, where I invented spinal instruments, where I teach surgery. And they have accused me, they basically photocopied the charges against me. No consent agreement. I was never offered a consent agreement. And the reason being was, what did I do? I'm not impaired. I'm not a drug addict. I'm not a drunk. I don't drink. I work 7 days a week, 365 days a year. I come home 10, 11 o'clock at night, and my poor wife, a nurse, puts up with this nonsense, or used to. And now I couldn't find her a doctor. She has some health problems. We had to go to Maryland. I had to drive 1,200 miles to Maryland every 3.5 weeks so she could see a doctor. So I'm a homeless, unemployable, Harvard-trained physician, the best in his field that this state has ever seen. And I'm not an egotistical guy. I'm just looking at the landscape. I'm the one that would never have an MRI on somebody with a metal object in their head without doing a CT scan first. But I watch my MRI scanner for $2 million and my CT scanner for $1 million get packed up in a box and go to Dubai. Because I lost my building, I lost my home, and I lost my ability to take care of the most severe thing is I lost my ability to take care of the people that need me. Some of them couldn't be here today, but we spoke on the phone. And they wish they could, but they are too sick to come. So what I tell you is this. I sat in a hearing for 3 days at 630 Camp Street, which is, by the way, the most heavily fortified building in the state of Louisiana. You can't get in there. There's armed guards after armed guards and bulletproof glass and elevators. And my poor wife, when we had my hearing, we don't like to be tried in the dark. I think in the American justice system, the courts are open. Anybody can go and sit in a courtroom, just like this chamber is open. They made her sit on the street corner in Louisiana, in New Orleans, in the middle of the night. Well, I stewed for 3 days, and I said to my lawyer, Joe Bruno, who's a smart guy, and Joe said to me, oh my God, I've never seen anything like this in my life, but he was trying to, preserve my license. But Joe was good enough to discount every charge that they made against me, but it didn't matter because the decision was predetermined, and that's what you don't realize, is that all of these decisions are predetermined by a nefarious group of people who love power and money. So let me just tell you about the money. The governor makes $127,000 plus dollars. An appeals court judge gets $159,000 or $157,000. City Mouton gets about $300,000 with benefits. I believe her niece is over there, and she has a job for $108,000. The law firm of Adams Reese gets $2.5 million. Rick Stanley and his little law firm gets $1.3 million. The unlicensed investigators get over $100,000, and I think you guys and ladies are getting $16,500 plus a small amount of expenses, right? Now, in the midst of a budget crisis, for years they voted themselves raises. They voted themselves raises. And if you look at the lawsuits, Parker versus Mouton, Michelle Parker, I spoke to a minute ago, she couldn't be here. 10 black employees were fired in one day, or a short time. And why were they fired? Not because these were decorated, hard-working people. Why were they fired? To support the high salaries and the legal fees. You as a lawyer would be shocked. There's no due process. And the reason these people sign those consent forms because they had a gun to their heads. And if you look at the bottom, most of them, you waive your constitutional rights at the end of it. You waive your constitutional rights. And I don't think any American should be made to waive their constitutional rights to support their families. And that's why these people committed suicide. I wake up every morning and I think about committing suicide. You know what? But I'm not gonna, because this woman here needs me. My children are sufficient. Although they would be depressed, they don't need me to survive. My wife has developed so many illnesses as a result of the stress of this and the loss of her home. And I will ask you in a very short way. Do not believe what they tell you. And if you want to see documents, I got 11,000 pages of them for you. And please come to my Fourth Circuit Court of Appeals hearing, which I'll announce the date. I would like all of you to come, and let's see how the cow ate the cabbage, I think, as the saying goes. But I want to leave you with a couple of things. Number one, the doctor suicides will continue. I hope I'm not one of them, but you will see more. Number two, I want to introduce you to Dana in a minute, which was the center point of my prosecution. And I want to talk a minute about Tanya James. As a prosecutor, I'm sure you do everything you can to make your case work, and so does the defense attorney. But you need evidence, and you need to exchange evidence. And what Representative Jackson was saying is absolutely true. You don't get the evidence. So I sat there in a hearing where they had a fake judge that gets $250,000, and he was a reasonable guy, but some people will do things for $250,000 that they might have not done otherwise. And I had a fake judge, and so the lawyer for the prosecutor is like the DA, is also the lawyer for the board, who is the jury. And then the judge, we had an old judge named Judge Ellis, who was, I think, a pretty respectable guy, and he said in the beginning, we're going to give you all the discovery you want. And then he was overruled by Dawson, the president of the medical board, who substituted himself as a judge, and then the lawyer for the investigator became the lawyer for the jury and judge. And so what I'm saying is, this is an anathema. This was said no in Haygood versus Louisiana State Dental Board. And you guys came and passed a law, 843, which became 441 in 2014, and they came here and swore that they were going to straighten out these problems. But guess who's the last person that was prosecuted under the old rules? Arnold Feldman. That's called a bill of attainder. That's not even legal. They prosecuted me. I had no due process. There was no judge. The jury was the judge was the jury. And my brother, who's a pretty smart guy, says, they could have taken the janitor and put a black robe on him. Would have been the same darn thing. He probably would have gotten a better shake. And so the point of the matter is that I can tell you right now, there's no due process there. There needs to be legislative oversight. Do not believe what they tell you. And don't think I don't respect Dr. Feldman, because I do. And he's new there. But how can you take everything I earned and everything I worked for? That is my property. That is constitutionally guaranteed by the Constitution of the United States and the Constitution of the state of Louisiana. And I am homeless at age 63 and unable to get a job in Louisiana, Alabama, Mississippi, the other states, Puerto Rico, Guam, and American Samoa. I can't get a job anywhere. So what am I supposed to do with my Harvard education? Well, I'll tell you one thing I did at the behest of this man. I went to church. Thank God for that. But God has empowered me with a brain. And see, you ladies only hear this stuff. I went through this for 3.5 years. Now, if I was a bad doctor, and I don't disagree with this, they should have the power, if somebody's really bad, to suspend their license summarily pending a hearing. They should have that power. If it's a, why did it take them 3.5 years to take my license away? You know why? Because this is what it is. And I want you to hear this very short. They're not truth seekers, they're case makers. Understand the difference? So I'm a victim, and my 1,000+ patients are victims, and my wife is a victim, and Dana, who wants to speak, is a victim. Oh, there you go. Okay, Dana was my right-hand person, and I'm going to leave it to Dana, and then I need to say something about Tanya James. But I was traveling back and forth to Linda's doctor, and I passed a place called Lexington, Virginia, and we went to the house of Stonewall Jackson. Those of you who have heard of Stonewall Jackson, I didn't realize this. He was shot by his own troops. They had to amputate his left arm, and Robert E. Lee said, he lost his left arm, and I lost my right arm when he died 8 days later. Dana became the target of the director of investigations, and you look at Dana. Dana comes from a big family, a very, very, very prominent family, and they looked at her, and despite her being a disabled American, they forced me to fire her in the middle of the night. Now, what due process, what authority does the director of investigations have to force a Louisiana citizen to fire a disabled American employee? Can you come up with a statute? Is it 49,964? Is it 37,1252? I do not know. But this is what happened to me. And one other thing, I had a patient that and I have to say this because her daughter asked me. I had a patient that was 40 years old, kind of like your relative, and she had four surgeries by a surgeon who operated on her December 31st and then moved out of town. Where's the medical board there? And he destroyed this woman's life. So I rescued her, and I implanted a spinal cord, a spinal morphine pump, of which I am one of the world's experts, not a local yokel. I'm a world's expert in this. Dana has one. And she got better. And they pulled her aside because she was vulnerable because her house burned down. Her name was Tanya James. And they went to her and they said, listen, we want to get Dana, because Dana was my right hand, like Stonewall Jackson. She helped me maintain these pumps, of which I had 250 patients. That's a lot for one guy. I mean, in that type of thing, it's very labor intensive. But Dana was my right hand. My wife was also my right hand, so I had two right hands. And so they went to this girl, Tanya James. They said, listen, we're going to get Dr. Feldman, and we want you to snap pictures without a subpoena, HIPAA violation, and they promised immunity to these people. Where's the due process there? And so she did that, and then she went to the pharmacy. She left my practice, and I thought to myself, because I knew my patients pretty well, I knew what they had for breakfast, most of them. And I said, where's Tanya? I hadn't seen Tanya in about 3 weeks or a month. Well, she left. Well, I said, what do you mean she left? So I go to the pharmacy where she went, and they said, oh, she went, the board told her to leave you, that they're going to take your license away. This is before I even had a trial. And she wound up dead 2 days later in the trailer of one of their paid informants named Andrea Heimbach. I want to repeat that. She wound up dead in the trailer of one of their paid informants in Livingston Parish, I think. So I went to the coroner, a guy named Coe, who I don't know personally. I said, I want to see the autopsy report. Well, we didn't do an autopsy. I said, what do you mean you didn't do an autopsy? Oh, well, she was a drug addict. I said, really? So after I sent a private investigator over there to get the autopsy report, I said, okay, well, you say she took too many pills. Where's the pills? Oh, we flushed them down the toilet. So what I'm telling you is this, is that we heard a little testimony. I lived through this, and you see what happened to me. Harvard-trained physician, unemployable, dead patients at the hands of this medical board. No due process, no records, no nothing. Hearsay, they convicted me. You read what they wrote about me, it looks like I'm like Jack the Ripper, but I'm really a good guy, and I can help people. And so my license is up, my suspension is up. I lost everything. I lost a $10 million building. I couldn't help you get to your car at this point. But in 6 months, when my suspension's up, they're never going to give me my license back. That's like Charles Manson getting parole. It's never going to happen. You know why? Because I challenged them, and I'm telling you the truth. So if you'll do for me one thing, look at your senator compatriots who passed this bill, I think 36-0. 36-0. Now you guys are every bit as experienced and smart as they are.
Smarter.
And smarter. I'm sorry. I'm not politically correct. Smarter than they are. And they were undaunted. They were not dissuaded by, oh, I think the rules say this and I think the rules say that. And if you will take what I say, and you don't have to believe me, ask Steve Carter, who was one of my good friends and a patient. Ask Franklin Foyle, who knows me well. I can give you the names of many, many people that know me well and looked at me as a verifiable person, as a generous person, as a hardworking person. And if don't do it for me, my life is destroyed. Do it for the future. Do it to prevent any more of these things that we're talking about, the suicides. Do it for Dana Bramblett, who lost an $80,000 a year job and now can't support herself. By the way, she was the sole provider. Her husband had kidney failure, was on dialysis. She was the sole provider. And I said to them, how can you do this? She's the sole provider. Didn't care. So the point of the matter is, I care, and I know you people care. And the one thing I love about big government buildings is I always tell people this, because I've seen it. You know, it's nice that you spend our tax money on marble floors and things like that, but you know what? If somebody drops a little drop of water, you slip, you're going to be one of my patients. But the bad part is I can't help you anymore. But maybe one day I'll be able to resurrect myself with your help. And if not, then I will be a fading memory. But if you can't do it for me, and I don't expect you to, but I am a citizen here, if you please do it for yourselves and your children and the rest of the people in Louisiana, And that medical board, you know what? You want to straighten it out? Put me on the medical board, because I know how things should be. And doctors are generally good people and shouldn't be made to commit suicide. But I'm going to tell you right now, he's bad enough dealing with the federal government. Bad enough dealing with Blue Cross. Bad enough dealing with sick people. Bad enough dealing with cancer. And when you do that 57 times a day, and then you got to deal with this, you can see why these people are pushed over the edge. And you know what, this is my
we have a question for you. Is that
bad,
okay?
I'm sorry.
Okay.
I'm finished, and thank you.
Representative Johnson.
Doctor, is it Farber?
Feldman.
Feldman. It's Feldman?
Yes, sir. Farber was one they got a few years ago.
Okay. Then I'm going to withdraw my question.
Okay. Mrs. Feldman, did you want to speak?
This is all out of my element, but he's probably said everything that I needed to say, but I mean, I want to back up what he said. I went through this, I've been through this with all of him, and there is no due process in this whole process. So I kept saying, how can they accuse you of anything with no evidence? I kept saying, just show me just one piece of evidence, and they didn't show anything. So, I mean, they've accused this man who has dedicated his life to his patients, and he loves his patients as they love him, and they're all lost without him. And honestly and truly, I mean, this whole board, they need to be revised. I mean, because I've never seen anything in my life how you can, convict somebody of a crime and not even have one piece of evidence due process at all.
Thank you, ma'am. Ms. Bramblett,
Okay.
please identify yourself.
Sorry.
Identify yourself, please.
Oh, okay. My name is Dana Bramblett. I'm from Walker, Louisiana. I'm 39 years old. I'm married of 15 years, I think. But I have my mom and my dad. And when I was little, my mom and dad was self-employed, and they taught me hard work and how to succeed in life. And if you want good things in life, you got to work hard at it. So when I graduated high school, I went to Southeastern University. And when I finished there, I decided I wanted to go into the medical field because I want to help people. I like interacting with people and helping people. So I went to surgical technology school. And when I finished surgical technology school, my first job out of school was Dr. Feldman. And that was in 2004. I started working for him. And then in 2005, I was diagnosed with multiple sclerosis. To tell you what kind of person Dr. Feldman is, him and his wife, Miss Feldman, brought me all the way to Houston to find the best physician to get the best care for me. And I really appreciate that. Sorry.
Okay. Go ahead, tell him.
Okay, and so working with Dr. Feldman, I wanted to learn everything. I worked hard. I wanted to get better and do everything I could to help the patients. So in 2011, I got a bad relapse from my multiple sclerosis, and I was sitting at my desk working, and I couldn't sit up, I couldn't stand, I couldn't talk. It was like I had a stroke. Well, Dr. Feldman accommodated me. I went to the doctor and had some treatments done, and he accommodated me and let me come back and promoted me as an administrator. And so, Dr. Feldman, let me tell you a little bit about him. He is a hard worker. I've never seen anybody. He would get there 8 o'clock in the morning and stay to 10 and 11 o'clock at night. This is no lie. We would stay and take care of our patients to everyone that needed help. We wouldn't leave to go home early. He was a perfectionist. He wanted everything to be done just right. He wasn't worried about money. We would take care of poor patients that couldn't pay anything, and they would pay the minimum every month. We would do procedures on them that cost thousands of dollars, and they might pay whatever their copay was or whatever, and they pay every so often. This is the kind of person Dr. Feldman is. He is not a criminal, and that is what the medical board has made him out to be. And moving on to my situation, in 2014, Dr. Feldman got called to the board for a meeting. And so I was sat at home, was waiting to hear from him, and I never heard anything. So actually, I was on my way to the office to move patients around. I said, well, maybe I should move the 8 o'clock patients to a later time until I heard from him. Well, I was on my way, and actually I was by Airline Highway, and he called me. I said, I'm on the way to New Pages. He says, don't worry about it. Can you come to my house? I said, yes, sir. And so I went to his house, and he said, come on in. These are the exact words I remember. Have a seat. I said, okay. And he said, Linda, where do we start? He says, okay, I'm just going to tell you. Cecilia Mouton is making me fire you, or I'm gonna lose my license. So just like that, I lost my job, no notice. I had my husband that I was taking care of for kidney failure. I had no income coming in, and because of the medical board, I have lost my professional. I've lost my profession. Now I can't do anything. Now I'm on Social Security disability because the board has ruined my career. And I think that's all I want to say. I'm just asking you to please support this bill and don't let this happen to future people. Thank you. Thank you for your time.
Thank you. Okay, we have some other folks who want to speak. I am going to ask you, obviously, we need to hear what you have to say, but I'm going to ask you to be as brief as possible simply because of our time limit today.
Thank you all for listening.
Thank you, sir.